Tori dancing. Oh, Erica dancing too. It's Friday. Oh, you got some Beetlejuice dancing?
No, apparently I use a lot of shoulder work.
All right. Okay. Dr. Coley is here.
So sorry.
Even though she may not want to.
Yeah.
I'm so sorry. Dr. Coley. And we're going to get to Dr. Coley in just a moment. But first, all week long, we have been speculating, along with the rest of the world, what is really going on with Kate Middleton. This doesn't really look like the princess. Now, even her look-alike in Britain is having to provide an alibi to prove it wasn't her in the video. Take a look.
No, it definitely wasn't me. So I was at work here, definitely wasn't me. And I do think it was 100% Kate and William in the video.
Oh, wow. Tori giving us some inside details. So today we thought we'd get a medical opinion on what might be happening with Kate Middleton. Dr. Coley, thank you so much for joining us. So here's what we know for sure, okay? Kensington Palace said Kate had quote, a planned abdominal surgery that was successful on January 16th. What are the most common surgeries for someone Kate's age?
So Kate is about 42 years old, and if you think about young women, one of the most common organs or organ systems that can be affected is the GYN tract, right? So we have our uterus, we could have fibroids, which are benign growths of the uterus. We have our ovaries, we could have tumors or cysts. We also have something called endometriosis. Do you guys know what that is?
Yep.
Yeah, a lot of women have that, right? Where your period sort of goes backwards and seeds the abdomen. So it could be related to that. It could be her bowel, her gallbladder. Appendix is usually more of an urgent surgery, and it could even be cosmetic surgery, like a tummy tuck or abdominoplasty or a hernia repair.
There is some breaking news I think we're getting. I want to make sure we're checking that she is saying that she has come down with cancer.
Oh my gosh.
She's just making a breaking news. I'm so sorry. I didn't want us to continue to speculate.
Thank you. So you just got this in?
Yes, and I wanted to let people know instead of us continuing.
Did she say what type of
I don't know
cancer?
much more about that, but she is giving an alert now. Again,
wow.
Something was wrong here. And
so now that we have, now this is all in real time, now that we have Dr. Coley here, if someone is in the hospital for 13 days, are they receiving chemo treatment? Is there a surgery happening? What would you say to that?
You know, we're seeing a rise of cancers in young people. And 42 years old to have cancer, it's a young person.
My sister did at 42.
Right, exactly. So it really depends on which type of organ was involved, what type of cancer. And, you know, if it's cancer that spread, it's certainly going to be a much more extensive abdominal surgery because sometimes they go in and actually cut out some of the spread. Like if it's gone to the liver or something, they'll actually cut out some of that. For some cancers, like ovarian cancers and others, if they spread to the inside of the belly, what's called the peritoneum, they actually put chemotherapy sometimes into the abdomen.
I'm just being told that she is receiving chemo treatment.
Yeah, she's undergoing treatment right now, yeah.
Not to speculate again, I want to ask more medical questions, but could that be her at that market with what she apparently seems to be going through right now?
You know, I mean, she's a couple of months post-op now, right? Because she had January 16th. So it's presumable she's recovered from the physical part of the surgery. And if she is getting chemotherapy, people who get chemotherapy, depending on the type of chemotherapy, don't necessarily have to lose their hair. Certainly eating can be a challenge with a lot of the abdominal chemotherapy. We could have problems with other types of side effects, nausea, vomiting, diarrhea, ulcers in your mouth and such, but it's not out of the ordinary for her to be seen walking around while getting chemotherapy. I have patients in my clinic every week that come in active chemo, even those with metastases who are still living their lives.
Yeah. I want to take a moment to talk about something that's trending that is along these lines, because Jessica Petway, 36 years old, African-American woman, passed away because she was misdiagnosed. They said that she had fibroids,
right.
and she really had cervical cancer.
Yikes.
So obviously Kate is in a situation where she has all of the resources in order to identify these things. But for the average person, if you are experiencing something and you're being told that it's one thing, but your symptoms are saying another, what do we do with that?
You know, I think this happens more often than we'd like to admit as medical professionals, but we're human beings too, right? Sometimes you misdiagnose, or sometimes you go in favor of what the statistics say, or sometimes the imaging tests can be wrong. They lead you down one path and it actually turns out to be the other. So I would say if you are continuing to have symptoms, feel like you've been misdiagnosed, getting a second opinion and or, you know, advocating for yourself and asking for additional tests, whether it's a biopsy or whether it's additional imaging tests. I had a patient just yesterday in the office who came to me for a second opinion because he was told he doesn't have heart disease. And to me, he had read the textbook on heart disease, but the test was negative. So I got a second test to prove to him and to me that we really aren't missing anything.
Can I ask something really important here? My mom died 2 months ago to this day of cancer. Let's just take a moment. Cancer is a big word, and we all just said it like it was, cancer's scary. What is it like, in your professional opinion, for someone to out themselves with having
She was kind
cancer?
of forced.
Agreed.
out.
I agree with
Yeah.
you. And how do you feel that? Because when my mom was told you have cancer, that changed everything. So she was sort of, she had to tell her hand. She did. She's in a public space. But what is that like? What is that like?
Cancer is one of the most difficult diagnoses people will ever get. Obviously, heart disease is much more common, but cancer can be much more devastating for yourself and your family members because the treatment options are limited as compared to heart disease, where we do have good interventions where we can change things. So, and it's an incredibly personal and difficult journey.
And that's to Tori's point, and I get it. She's a public figure. The tax dollars of, England pay for her salary, but clearly she wanted to keep this private. Right. Clearly she wanted this space to be alone and to deal with this in her own means and in her own emotional way. And because of all the speculation, I think she was kind of forced to come forward. And
I also
hopefully
think
that doesn't affect her recovery.
During a cancer journey, there are different chapters. The beginning chapter, it's a shock. Right? It's the 5 stages of grief. And so until you feel like you're in a place to share, I don't think we should ever put anyone, whether they're public or not, into that position where they have to tell everyone, because it can affect you psychologically. As you know, Sam, it's with your sister and, you, Tori, with your mom. I mean, when you have a family member, it's a different journey for every person and their family.
Wow. Well, we're going to stay on this. Dr. Coley, you can stick around because this is all happening in real time and we want to be able to address it. In fact, we're trying to get her actual statement as well. So stay with us. We'll be right back.